And next up, we have Sharon Leong, and she is a clinical psychology PhD student at the University of Kentucky. Her research interests span across multiple topics, including neuropsychological assessment, neurorehabilitation, and single-session interventions. She currently studies the effects of intimate partner violence-related brain injury on cognition and mental health, with hopes of developing a treatment intervention for women survivors of intimate partner violence. Beyond her research, Sharon mentors underrepresented students interested in pursuing a graduate degree in psychology and has participated in graduate school application panels and events, including delivering a virtual presentation on post-bac research positions with over 100 global attendees. So with that, I hand it over to you, Sharon.
Thank you so much for that wonderful introduction. Let me go ahead and see if I can share my slides at this time. All right, can you see that okay?
Yep.
All right. Thank you so much. And so before I get started, I definitely wanted to include a content warning, as I'll be discussing sensitive topics related to intimate partner violence, including brain injuries and other health outcomes associated with these experiences. I also wanted to thank all of the survivors for sharing their experiences with us and giving us their data. And additionally, wanted to thank our lab manager, Agnes White, and my research mentor, Dr. Justin Carr, for making this research project possible. And so today, I will specifically be presenting on a research study I conducted on the polytrauma clinical triad among women survivors of intimate partner violence, or IPV. And today, my talk will primarily be focused on the survivor experience located in the US. Okay, and so to first start off, I wanted to broadly define the polytrauma clinical triad, which describes the co-occurrence of 3 conditions listed here. Before I go into this definition, I just wanted to highlight all of the speakers that we've heard from already, and some of the speakers have already mentioned the importance of attending to physical health needs among survivors and not just mental health needs. And so looking at this framework, we can really see here that we are looking at both the physical health needs and the mental health needs of survivors. And so for the first component of the polytrauma clinical triad, this is defined as neurobehavioral symptoms. These are symptoms that are non-specific, meaning that these symptoms can occur across different conditions. And there are 3 types of symptoms associated with neurobehavioral symptoms. The first type includes cognitive symptoms, including trouble with memory, trouble with concentration. The second type of neurobehavioral symptoms include physical symptoms, including headaches or having trouble with falling asleep. And then the third type of neurobehavioral symptoms includes emotional symptoms, things like feeling irritable or feeling blue. The second component of the polytrauma clinical triad includes post-traumatic stress disorder. So these symptoms include things related to re-experiencing a traumatic event, so such as experiencing flashbacks, avoiding people, places, or things that remind someone of a traumatic event, hyperarousal and reactivity, so feeling jumpy or on guard, and then also just experiencing negative changes to cognition move overall. The third component of the polytrauma clinical triad includes chronic pain, which we can think of this as physical bodily pain occurring a long time. And so the importance of the polytrauma clinical triad is that this has actually only been predominantly studied among male veterans, and these prior research studies found that individuals who met criteria for this triad had worse health outcomes than individuals who had these individual conditions in isolation. And so some of these worsened health outcomes included greater rates of suicide risk and additional sleep problems. And so this research study is the first to examine the polytrauma clinical triad among a sample of women survivors of intimate partner violence, or IPV. And these survivors oftentimes report symptoms related to all 3 of these conditions. Okay. And so as many of you probably know, women survivors remain underrepresented in the traumatic brain injury, or TBI research, despite how frequently IPV occurs. So for example, specifically in the US, approximately 1 in 2 adult women have reported experiencing stalking or IPV in their lifetime. And as you can see here on the statistics on the slide, researchers report different rates of TBI, PTSD, and chronic pain among different samples of survivors. And despite the large ranges of these rates, one thing is really clear, and that is that survivors frequently experience traumatic brain injury, PTSD, and chronic pain. And so for the study, I used different measures, which are located here on the slide for anyone who's interested. And we asked survivors about their experiences related to acquiring a brain injury due to an intimate partner. We asked about their neurobehavioral symptoms using the Neurobehavioral Symptom Inventory, or the NSI. We also looked to see what symptoms of PTSD survivors might have had, and then also asked just some questions about chronic pain experiences. And so how we defined the polytrauma clinical triad for this specific study is located here on the slide. And so for study criterion for neurobehavioral symptoms, women needed to endorse at least 3 neurobehavioral symptoms in the past 2 weeks and rated these symptoms as moderately severe or greater. To meet criteria for PTSD for the study, women needed to meet the threshold cutoff score of 33, which is based off of some score for PTSD symptom severity. And then for chronic pain, we asked questions about pain frequency and duration. And to meet criteria for this component, women needed to endorse pain on most days lasting 3 months or more. Okay. And so there's a lot of different numbers on the slide, no worries. I'll walk you through each of the stats, but essentially the goal of this study was to look at 2 groups of survivors. The first group included women survivors with no lifetime TBI history, and the second group included women who reported at least 1 IPV-related TBI. And so overall, we see that our sample was around 40 years in age. They were mostly white women who were also identified as non-Hispanic. Many were college educated, and actually only a small subset of our sample experienced IPV within the last year. And so in the bottom half of the slides, we see that in this sample in particular, women survivors with IPV-related TBI were generally older and had less overall education than women survivors without lifetime TBI history. Additionally, we noted that specifically looking at the women who endorsed at least 1 IPV-related TBI, most of the women reported experiencing mild TBIs. And also just for all of your information, we recruited all of these women survivors online. Okay. So now stepping into the results, here we have 2 Venn diagrams. The first Venn diagram on the left represents the rates at which women with at least 1 IPV-related TBI met criteria for different components of the polytrauma clinical triad. And then on the right side, we have the Venn diagram for rates for women survivors with no TBI. And so right off the bat, we can actually see highlighted on the left that women survivors who experience IPV TBI are more likely to meet criteria for the polytrauma clinical triad. Here's another way of representing the data. Just to note, for these tables, participants could meet criteria for more than 1 condition, which are listed out on the left-hand side. So what I mean by this is that participants who met criteria for the polytrauma clinical triad would also meet criteria for symptom dyads and also in the individual symptoms themselves. As you can see here on the slide, highlighted in pink, these were the group differences across our sample. And we can see here that IPV-related TBIs were associated with greater rates of the polytrauma clinical triad, but we also noticed that IPV-related TBIs were associated with greater rates of neurobehavioral symptoms with chronic pain, PTSD with chronic pain, and chronic pain as an isolated outcome. These results remain true after adjusting for age and education, meaning that we held these variables constant and then redid our analyses. Okay. And now looking at just the number of lifetime TBIs and how that relates to the outcome measures, we saw that the more lifetime TBIs a survivor experienced, the more likely she was to also have chronic pain with co-occurring neurobehavioral symptoms, and also just chronic pain in general. Then looking at specifically the subsample of women who reported at least one IPV-related TBI, we saw that among these survivors, the more recent head injuries they experienced, the more likely they were to report at least 3 moderately severe neurobehavioral symptoms in the past 2 weeks. And so what does this all mean? First of all, based off of our results, we saw that chronic pain was present for all of our significant group differences. What this might mean is that chronic pain could be a principal component of the polytrauma clinical triad among women survivors of intimate partner violence. Specifically looking at neurobehavioral symptoms, surprisingly, we did not see an association between IPV-related TBI and neurobehavioral symptoms. A few things to consider as to why we saw these results was that, one, most of our participants did not experience recent IPV compared to other samples of other studies. And then two, our study used a different operational definition for neurobehavioral symptoms. So for example, here we had women meet criteria if they had 3 symptoms or at least 3 symptoms of moderate severity or greater, and other studies might have used severity scores or just the number of symptoms that women experienced and reported. Now, specifically related to PTSD, we also did not see an association between IPV-related TBI and PTSD, at least in this current study. So other considerations as to why we saw these results were that, one, our study was all recruited online in terms of our participants. Thinking about previous studies who recruited survivors from other settings such as healthcare, legal, and IPV recovery services such as shelters, generally speaking, survivors seeking out these specific services are more likely to experience more severe forms of IPV. And so since our sample was recruited online, perhaps our study participants did not experience as severe of IPV experiences as perhaps other samples did. Okay. And so just in summary with what all this study results mean, first of all, we did see an association between IPV-related TBI and polytrauma clinical triad, and that women survivors with IPV-related TBI were more likely to meet criteria for this triad than survivors without lifetime TBI history. A second finding that we saw was that chronic pain was a principal component for this sample, as it was present among all group differences. And so the future directions for research related to this topic is that we could look at other conditions associated with IPV, such as anxiety and depression. And in doing so, we could potentially include more conditions in defining the polytrauma clinical profile for survivors. Another thing researchers could do is replicate this study with other samples of survivors, just to see whether the polytrauma clinical triad occurs at similar rates among survivors from different recruitment settings and different communities. And then finally, real world and clinical implications. As some of the survivors have mentioned, there is definitely a need for a one-stop shop or a network of providers and services, given the number of needs survivors have due to their experiences. And so this study really emphasizes the need for interventions that treat more than one condition, including neurobehavioral symptoms, PTSD, and chronic pain. And finally, for folks who want to treat these conditions or do treatment planning with survivors, chronic pain may be a priority target for survivors, especially women who report TBI history. And with that, thank you all so much for listening. And if there's any room for questions, I'm happy to field those as well.